Hello viewers, welcome to HMSDESK. Today, let's delve into the world of pediatric cardiac surgery. Pediatric cardiac surgery is a specialized branch of medicine that focuses on diagnosing and treating heart conditions in infants, children, and adolescents. It is a remarkable field that plays a crucial role in saving and improving the lives of young patients with congenital or acquired heart diseases. Pediatric cardiac surgery encompasses a wide range of procedures, tailored to meet the specific needs of each child. Some common pediatric cardiac surgeries are: repair of congenital heart defects. This involves correcting structural abnormalities present at birth, such as ventricular septal defects, atrial septal defects, tetralogy of Fallot, or coarctation of the aorta. Correction of valve abnormalities. Pediatric cardiac surgeons can repair or replace heart valves affected by conditions like valve stenosis, regurgitation, or endocarditis. Treatment of heart tumors. Rarely, children may develop tumors in the heart. Surgical intervention may be required to remove these tumors and restore proper heart function. Fontan procedure. This surgery is performed in children born with single ventricle defects, where the heart has only one functional pumping chamber. The Fontan procedure redirects blood flow to improve oxygenation and circulation. Heart transplantation. In severe cases of heart failure, where other treatments are not sufficient, heart transplantation may be considered as a life-saving option for eligible pediatric patients. Pediatric cardiac surgeries require highly specialized skills, expertise, and a multidisciplinary approach involving pediatric cardiologists, cardiac surgeons, anesthesiologists, and a dedicated team of healthcare professionals. Now, you may be wondering about the procedure itself and why you should choose HMSDESK for your child's pediatric cardiac surgery. Let me address those concerns. HMSDESK is a trusted healthcare facilitator that connects patients with renowned pediatric cardiac surgeons and top-quality hospitals. We prioritize the safety, well-being, and satisfaction of both the child and their parents throughout the entire medical journey. By choosing HMSDESK, you can have peace of mind knowing that your child is in the hands of highly skilled and experienced pediatric cardiac surgeons. They specialize in treating heart conditions in children and work closely with families to provide personalized care and support. HMSDESK takes care of all the necessary arrangements for your child's medical journey. We assist with scheduling appointments, provide guidance on preoperative preparations, and ensure a comfortable and seamless experience for both the child and their family. Our dedicated team coordinates all necessary tests, consultations, and follow-up care, ensuring comprehensive support throughout the process. We understand the importance of personalized care and family involvement, and our team will be there to address any questions or concerns you may have. Your child's well-being and satisfaction are our top priorities. The cost of pediatric cardiac surgery can vary depending on several factors, including the specific procedure, the complexity of the case, and the hospital facilities. On average, the cost can range from $20,000 US to $100,000 US. However, it's important to note that these figures are approximate and can vary based on individual circumstances. If your child requires pediatric cardiac surgery to treat a heart condition and improve their quality of life, don't hesitate to contact HMSDESK. We are here to guide you and provide the necessary support. To learn more about our services and how we can assist you, please visit our website at hmsdesk.com or email us at support@hmsdesk.com. Thank you for watching, and don't forget to subscribe, like, and share our channel to stay updated with the latest healthcare information. Remember, your child's well-being matters, and we are here to serve you on your journey to a healthier and happier life.